Heel pain is a mystical disease that everybody seems to have. It's growing. People say it's a heel spur. It's a heel pain. You know, when you get up in the morning, those first few steps, I call it the 5-step shuffle. You know, you have to walk and before you can get that foot loosened up. You know, a lot of people have it. They will sit down at lunch and get up. Their foot hurts. You know, everybody wants to call it a bone spur. You know, there is a spur there a lot of the times, but that's not the cause of the problem. Usually it's that soft tissue band. You know, the problem, you know, actually stems, you know, from a lot of times it's a tight Achilles tendon. And we want to look at a lot of stretching exercises with you. We want to look at, you know, possibly injections. We want to look at some taping. Orthotics. You know, everybody wants to know, what's an orthotic? You know, I've seen these. It's Dr. Scholl. And it's not. You know, an orthotic is a lot like your eyeglasses. You know, it's a prescription that's specifically made for your foot that will help biomechanically balance your foot. You know, if you don't wear them, they don't work. Just like your eyeglasses. You know, they will help slow the progression of your problem down. They never stop it, but they will slow it down considerably. That puts our visits apart that way. You know, so you're not seeing us, you know, every week or every 2 weeks. If I can get you in a nice orthotic with a night splint, you know, we can part ways. And, you know, I can keep you very comfortable and usually without ever having surgery involved. I would say that we've maybe taken 3 people to surgery in the last 4 years for heel pain. You know, it's a conservative process, and we've had very good luck and success with our protocols.